The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified, and I am Tony Urbanic. Today, we're going to continue on with the serial, S-E-R-I-A-L, serial topic that I chose to begin covering, called value-based TMD treatment. Again, to remind you, this is based on a book by Dr. Robert Pearl, in which he talks about value-based medical care, medical treatment. So I give him all the credit for engendering the concept. I don't take anything away from him, but I'm just carrying on this concept as it applies to TMD in dentistry. TMD is a dental problem, unfortunately, although TMD is a medical problem, but it's left to the dentist. So it's a dental problem that's medically derived. I'll make that clear. But medical doctors aren't going to futz with TMD. Certainly not at this point, and they don't have enough basic knowledge that's necessary to treat TMD properly and correctly. So it's left to us, the dental doctors, to grab a hold of this by the horns and figure it out and apply the knowledge for the patients who desperately need it. And there are plenty of those. I'll just remind you, 45% of females have temporomandibular joint symptoms. When you include all of the other symptoms that have been misdiagnosed, primarily by our medical colleagues, that is confusing TMD with migraine headaches, confusing them with ear infections, and confusing it with Meniere's disease. And I've talked about that extensively. We're not going to go into that today. So today's topic is a continuation of value-based TMD treatment, part 3, excellent patient compliance. So if you're going to be treating any medical problem, you have certain, and this is carry on with the concepts provided by Dr. Pearl in his book. You have to have certain things covered for the patient to provide what he considered value-based care, which doesn't necessarily have to be the least expensive. It doesn't have to be the most technically smart. It has to be value-based, basically the best value that you can discern or create. Like a Chevy would be very valuable in comparison to a Maserati. And that's what patients need and what they desire and what is necessary in our healthcare system. And that the concept of value-based healthcare I covered in previous episodes. So today we're going to focus down on this process, and that is part of value-based treatment, TMD treatment, would be to encourage and have, as part of the treatment, excellent patient compliance. Of course, I'm sure that most of you are familiar with patient compliance in your dental fields. Patient compliance is having the patient do what you need them to do, what you ask them to do, what the recommendations were made for them getting the best results of whatever your treatment is. So, and patient compliance has a lot to do with the outcome. If you don't have good patient compliance, sometimes you can do the best care, the very best care, the best technical care, the best skilled treatment, and still come out with a bad result because you did not have patient compliance. We all know that, and we all have to deal with that, some more than others. Some things you don't need a whole lot of patient compliance on, but patient compliance is necessary in all fields. I dealt with the problems of patient compliance when I engaged as a maxillofacial surgeon for the better part of 48 years, doing oral and maxillofacial reconstructive procedures, and patients who would hopefully and gladly and greatly appreciated, did not happen very often, but patients who cut their own wires out. If I had a fracture to fix, or we had orthognathic surgery and they had to be, held in fixation for a length of time, some patients just absolutely refused to go through the compliance of staying wired together. And in multiple occasions, it ruined the operation. So I'm familiar with patient compliance. So we can define it. I think I've done that well enough. And a couple examples showing the range of differences between patient compliance and the ease of patient complying. And there's certain aspects to compliance that makes it easy for the patient to comply, and the things that make it difficult for the patients to comply. And when it comes to treating TMD, we want to make it as easy and as understandable for the patients to comply, not to comply. Because in our case, a device, and let's just keep it generic, a device on which there is a claim that it treats TMD successfully, this device has a protocol that comes with it. You just don't, give it to the patient, pat them on the head and say, good luck. There's a protocol that is worked out to use it, which has shown that works best when they follow the protocol. And to follow the protocol, you have to have good compliance to follow the protocol. So a couple examples of the range of compliance that you see, that probably the one that we are all most familiar with is the prescription written on the pharmaceutical bottle, the pill bottle, that says something like, take one tablet every 3 hours, or take one tablet 4 times a day. Well, if that prescription is simple, and most of them are, is how it is written, to take a pill, patients will most often comply. And of course, you know that even then patients don't comply completely. But fortunately, with most medications, the way they are written, the prescriptions are written, and the timing of them, you can still get away with a lot of non-compliance, but still have the prescription kind of work. Antibiotics would be a good example. If the patient does not take the antibiotic 4 times a day, exactly every 6 hours, most of the time they get enough antibiotic in their system that it is effective. Occasionally not, but even with a simple request for compliance, it doesn't happen all the time. Now, a good example of non-compliance that happens very frequently, and that is the colonoscopy prep. I'm familiar with that personally, and I took the time to look up the average, a description of the average colonoscopy prep from a reputable large organization that does thousands of colonoscopies, and it ran 8 pages. 8 pages of instructions to do the colonoscopy prep, which is to clean out your colon so that the gastroenterologist has a great view, a clean view of the entire colon. And my gastroenterology colleagues, as I sat with them in surgeons' lounges and them getting ready to go in colonoscopy, constantly complained about patient compliance. And the patients would not comply with the entire colonoscopy prep that was prepared, and there are certain rules and timings and amount of medication to clean, the colon out. But they complained bitterly. And of course, when they did not have a clean colon, then the results were in question and ruined the entire process. So this is an example of absolutely very, very poor patient compliance, which had a significant outcome for the patient and the procedure. So what does it take to have good compliance? If you have a device, generic device for the treatment of TMD, non-surgical device and protocol, because they have to have add the protocol to the device. The device is just a tool. You have to learn how to use the tool. Then how do you get good compliance? Well, the things that stand in the way of good compliance is what we're going to cover next. And there's a whole list of things that if you get rid of the things that decrease compliance, then naturally you'll get good compliance because it's easy for the patient to do. That's why I brought out the two excesses of patient compliance, basically the prescription on the pharmacy bottle versus colonoscopy prep. One was extremely simple, one was extremely complicated, and one you usually got good compliance, and on the other you really had a problem with getting compliance. So to get good compliance, first of all, if it's too complicated, that is what you're asking the patient to do is too complicated, you will decrease compliance. So, if the instructions aren't well understood, if they don't understand the words that you're using, if the entire process seems too complicated to them, some people won't even try because they know they won't get compliance. If the procedure or the recommendation that is given creates pain or uncomfortableness, it's just called being uncomfortable. Some patients won't comply. Good example of this, it doesn't apply to adults too much, but I mean, if you ask a patient for a prescription, if they need an injection, some people won't comply because, an injection is involved. They just won't comply. If it creates pain in any way, it decreases compliance. If the procedure that is requested or the instructions are too long, if it takes too long, it gets kind of rolls into the same thing. It's too complicated, but it takes too much time. Time is to most people very important. They don't want to devote a lot of time. They want things easy. They want it as easy as possible. Therefore, you won't get compliance. That reminds me of a meme that I actually had in my possession. Unfortunately, I can't find it now, but it's a meme which had a drawing of what looked to be a drive-through, like a McDonald's drive-through, with a car at the side of the drive-through, with a patient in a convertible with their head inside the window, the drive-through window, and the title of the meme was Dr. Jones, oral and maxillofacial surgery, get your wisdom teeth out here. The meme is, made it easy for the patient to get their wisdom teeth out. They could literally drive through, stick their head through the window if you didn't get the humor on it, and get their 4 wisdom teeth surgically removed. And it made it very convenient for the patient. And therefore you would get good compliance for the patients having their wisdom teeth out. But if it's too long a procedure, if it's too long a process, you won't get good compliance, decreased compliance. If it's too expensive, you won't get good compliance. And I won't call out different kinds of procedures. Different procedures They're valued at different rates. And can be very complicated, but again, in the patient's mind, I mean, so what some patients feel is expensive, other people think is very inexpensive. And I had that happen constantly. I mean, some people, you will quote a fee, and I've literally had people tell me, well, that's a deal. And I've had people say, oh my God, that's like a ripoff. And you're quoting the same fee, you're just talking to a different person, and they have different values of money, and understandable, no complaint there. But in the patient's mind, if it's too expensive in dollars, then your compliance goes down. So again, to remind you, what we're talking about is cranking in value to what you're doing, and in this case, cranking in value to TMD treatment. If it's too inconvenient, I guess I told my story prematurely about putting your head inside the drive-through window to get your wisdom teeth out. That's convenience. I mean, I tell as a humor point, I mean, what patients want is they want you to, bring your dental equipment into their living room so that they can continue to watch TV or stay on the internet while you do your dentistry. And if you were willing to do that, I'm sure you'd have a lot of people that would have you do that for the convenience of it. So the things that make it inconvenient for patients are multiple recurring treatments. For example, well, a good example would be Botox. That's a multiple recurring treatment. Only lasts 3 or 4 months, and it has to be repeated. I have my own opinion, which I've stated many times, and Botox only treats a symptom to begin with, and only a localized symptom, although I've had patients who have had their entire face Botoxed. I have seen that. Their entire face has been Botoxed for what they considered or someone else considered TMD. Another example of multiple recurrent treatments that have to be done continuously that decreases compliance would be chiropractic. Again, I have nothing against or chiropractic. It's a good service. One of the things about chiropractic is you have to continue on the process. And some people find that difficult, and therefore they're non-compliant in returning for all the services. Occlusal rehabilitation would be another. You have to, how long, how many procedures, how many visits to the office, how many things you have to do over a long period of time to do an occlusal rehabilitation, basically crown all of the teeth. I've had people had recommended and done that for the treatment of TMD. Orthodontics is another good example. How many appointments you have to make over 18 to 24 months to go have your orthodontics done. And again, I have innumerable patients who have been told and gone through orthodontics and told that was the solution for their TMD. Physical therapy would be another example of multiple recurrent treatments. The most common treatment by the physical therapist, in my view, my understanding, is dry needling, although manipulation of the jaw is done frequently too, which is contraindicated, actually. Physical therapists, they manipulate the arms and the legs, and works really well if you have total joint reconstruction of your hip or your elbow or your knee, and you have to get the motion going. But when you have chronic inflammation within the temporomandibular joint, manipulation of the mandible is contraindicated, but is one of the recurrent treatments performed by physical therapists along with dry needling, but it takes multiple appointments. And if the appointments get too multiple, then the patients decrease their compliance. So the next is too many unintended consequences, basically side effects. If the patient begins to see side effects, i.e. unintended consequences, nobody wants to create side effects. But if there are too many side effects, then the patient will become non-compliant. And I think that is a good example of that is actually the side effects of the different drugs that are used to treat these symptoms of TMD. The one that comes to mind that I hear about most frequently is muscle relaxants, and the weird sensations and the weird side effects, mental side effects, emotional side effects, physical side effects of taking muscle relaxants. Although I've personally experienced hundreds and hundreds of cases of patients being put on opioids, being put on neuroleptics, anti-anxiolytics. All of those are well known for unintended consequences and side effects. And if the side effects get too great, or they're not easily acceptable by the patient, then it decreases their compliance. And then the last I want to mention is the inability of the patient themselves to understand what the treatment is all about. I have found that if the patient can make sense of the common sense of the treatment that is being offered, then they are more likely to be compliant with doing whatever is asked, whatever is recommended. If it's all Greek to them, they have no idea, then it's basically, if they do it, it's just on a level of trust, total misunderstanding, no understanding of what is being done, and therefore compliance decreases, not as compliant. And the objective is to get the patient to be compliant with the process. And that is why, in my own case, I spend a little bit of time, a few minutes. When I say a few, maybe 3, explaining, maybe 4, explaining to the patient how the process works, the protocol of wearing a non-surgical device intraorally for 24/7, 24 hours a day, 7 days a week for 2 months, and take it out when you eat, clean the device, put it back in your mouth, and after the first 2 months, and it's nighttime only indefinitely the rest of your life, or when you sleep, nighttime only. The statistics we have found that 85% of the patients, that's all they have to do is keep it in their mouth nighttime the rest of your life. 15% find they need to wear it more during the day. We have lots of examples, but it's really roughly about 15%. But they control it themselves as to their degree of symptoms or discomfort. And if they're comfortable, then nighttime, and if and when they start to have a problem, which is frequently seen when they go back to the dentist to get their teeth cleaned, or yell at the dog open widely, or sing in church open widely, it will stir up inflammation within the joint, at which point they find that it is appropriate to put the device in your mouth an additional 6 or 8 hours a day until things calm down. They don't have to go back to 24/7. So those are the things that create non-compliance from a patient. Now, if you have a non-surgical device, you don't have to worry about any of the non-compliances created by surgery. You don't have to worry about any of the non-compliances created by drugs. You don't have to worry about any of the non-compliances created by recurrent Botox or medication or trips to the orthodontist that are created. And the beauty of it is that the protocol is extremely well laid out, really simple. And we find that compliance works really well mainly because of this one reason. As they begin to use this device, the painful symptoms almost always within the first week or sooner, they will start to see a decrease in painful symptoms. It does take a little time for inflammation to decrease once you unload the temporomandibular joint. Again, for any newbies on the channel, this device, which fits in the anterior of the mouth, does nothing more, nothing less than decrease the loads on the temporomandibular joint. The symptoms are created by inflammation within the joint. They are directly created by inflammation within the joint. If you decrease the inflammation, you decrease the symptoms. As you unload the joint, like a set of crutches unloads an inflamed knee, the inflammation decreases. As the inflammation decreases, the painful symptoms decrease, and painful symptoms of the temporomandibular joint and the inflammation in the temporomandibular joint takes a little while, usually a few days to a week, and they will see significant decrease in inflammation, therefore significant decrease in painful symptoms. And that increases their compliance because they immediately see some difference, in some cases, significant difference. And I don't want to, there's a range. I mean, I have had people say, within a week or two, 100% of their symptoms are gone. That's a little unusual. And it's also unusual to go out more than a month. I mean, it's very unusual to go out more than a month and say my symptoms have not decreased at all. That's really unusual. So there's a bell curve. They have two tails, but the majority of people report that within the first week or so, week 10 days, they see significant decrease in painful symptoms. The non-painful symptoms, which are primarily described as tinnitus, subjective hearing loss, and vertigo, take a little longer because it takes a little longer for the inflammation within the middle ear to decrease. It doesn't decrease as the inflammation decreases, but it doesn't decrease as rapidly within the middle ear because it's a closed system. The middle ear is a closed system. Inflammatory fluids, change in pH, whatever it is that creates it within the middle ear, that inflammatory effect takes a little more time to calm down because the middle ear is a very closed system. But the influence of the inflammation derived from the glenoid fossa through the petrotympanic fissure takes a little time to back off. But the point is, because you almost immediately see decrease in painful symptoms, which is almost everyone's primary consideration, whether it be pain of the headache, the pain of the earache, the pain of the jaw pain, pain of the neck pain. But when they start seeing decreases in those painful symptoms, then they are encouraged and their compliance rate goes way up. And so you have less problem with compliance. The process, the protocol itself is very simple. It's laid out. It makes sense 24/7 for 2 months and nighttime only the rest of your life. And with that in mind, the patients say, well, that makes sense. And when you explain it to them in terms that they can understand how inflammation within the temporomandibular joint is no different than the inflammation within tennis elbow or the inflammation within an inflamed knee, that you put on the knee, you put on crutches, and the elbow you put on the sling, which is, if you have tennis elbow, that's the primary first treatment recommended for tennis elbow, is just put the arm in a sling and rest it. And a device that unloads the temporomandibular joint by disoccluding the posterior teeth, of which 90% of the loads on the temporomandibular joint are from the posterior teeth. So you unload the posterior teeth, you unload the joint, you decrease the inflammation, you decrease the symptoms. It's quite simple. The whole concept is quite simple. And the whole concept of gaining patient compliance through a simple process that now you have something that is very understandable to the patient, very effective to the patient, and you get good compliance, and then they're happy and they sing your praises. So I think I made the point on this one, and I would like comments. If anyone would like to comment on what I have to say or criticisms, I am welcome to those. I can be reached at Tony@tmjservices.net. If there's anyone who is listening to this episode who would like to join our network of doctors who use this device, we had to call it the Urbanic device, for their patients, become network providers, I guess the first stop I'd recommend is our website at www.urbanictmj.com, which is a tremendous amount of information. Of course, our podcast here, this is the 135th episode of TMD Demystified. I also do a blog, which is directed primarily to patients, which is on our website. All this information is available to you, but if you'd like to join the network, our Director of Operations, Dr. Naomi Williams, can be reached at naomi@tmjservices.net. And I'm always available to answer questions or to talk with doctors who have problems with their TMD patients who would like more information, and certainly that we're here to help. So until next time, I look forward to speaking with you. We're going to continue on this series of value-based TMD treatment and emphasize value to what we're doing. It's a valuable service, and it's a valuable service to the patient. And if it's valuable enough to the patient, then they will be very compliant and be good patients for their needs and for your practice needs. Until then, I am Tony Urbanic, and this is TMD Demystified.